nebulizer, where a drug is instilled into a container and through a mask it is administered to the baby's face in a mist form. So while using a nebulizer, first you should wash your hands, put the medicine in the nebulizer, connect the tube to the compressor to the base, connect mouthpiece or the mask, turn on the compressor, wash the mist coming up, and once the mist is there, put the mask onto your child's face. Ideally, it should be given along with oxygen because a tight mask can cause breathing issues. So if you have supplemental oxygen, it is more comforting for the baby. And once the mist is in free flow, the baby is asked to breathe in and breathe out until the mist stops coming. So once it is done, the nebulizer can be switched off and can be removed. Sometimes the kids are very scared to put on the mask. So in that case, you can at least hold the chamber without the mask as close as possible to the nose. After that, the child may have bouts of cough and they may spit off a lot of mucus. So this is one of the early treatment options when the child is starting to get exacerbation. Because it's a temporary thing, parents are more comfortable. The advantage of nebulizer is that it is directly administered to the lungs where the actual problem is occurring, and so the relief is also quite quick. Now, the best option for administering medications directly to the lungs is actually inhaler with a spacer. It's a valve kind of holding chamber with a face mask attached to a metered dose inhaler. So again, while you're using it, you should wash your hands. The first time you're using it, you should prime the inhaler by spraying it 4 times into the air. Before each usage, shake it for 10 seconds. Put the inhaler into the opening at the end of the spacer. Have your child turn their head to the side, ask them to breathe out, and then ask them to close the mouth tightly around the mouthpiece of the spacer. For smaller children, you have got face masks which have to be tightly placed on the baby's face, covering the nose and the mouth. And then you give the first puff and tell them to take slow deep breaths. Ask them to hold it and count 5 up to 10. 7. And around 6 breaths allow the puff to be completely inhaled inside through the spacer. Have them slowly breathe out, and after this, if you want to give more puffs, give a 1-minute break and then repeat all over again. And immediately after using inhaled medications, ask them to rinse them out, especially after inhaled corticosteroids. It is better to brush the teeth along with it and drink a little bit of water. The advantage of inhaler over the rest of the oral medication is that, again, as mentioned in nebulizer, this medicine is directly going into the lungs, and so the relief is quite quick. The advantage over nebulizer is that it can be carried along with you. It can be used anywhere, and once you don't need a power source, and once the child is comfortable using it, they can use it without much effort, and they are also quite comfortable using it because it gives a quick relief. They don't mind using it repeatedly if a need arises. Another major advantage of inhaler is decrease in side effects, because if you are using an oral medication or a systemic medication, it has to go to the circulation and then increase the blood levels and then give some relief. But here what is happening is you are directly inhaling. There is a direct effect on the area where there is the real problem, and then it is exhaled out, and so the side effects are very minimal while using an inhaler with spacer. So what happens is, usually as soon as parents are given an advice regarding the usage of inhaler, most of them change the doctor and go to a place where they do not talk about inhaler initially, and then they probably hide the history of previous wheezing episodes, and then the whole cycle continues, and at one particular point that doctor also talks about inhaler, and that doctor is also changed, and at one point they understand the child is suffering for too long, and then they start using inhalers. By that time, probably there would have been quite a significant amount of damage to the growing lungs. So if you have been advised regarding usage of inhalers, it is for the good of the baby, because it gives quick relief and it is with minimal side effects. Happy parenting.